So how do we restore nasal breathing in you or your child when it feels like when you close your mouth and only breathe through your nose, you get uncomfortable, short of breath, panicked, you just feel like you're not getting enough air? There's several ways to address this in a very natural, non-invasive way. And I would start here before doing anything more dramatic. Addressing the basics can get you a long way. Okay, so the process, depending on the severity of the blockage in your nasal cavity, is going to follow the process of, okay, let's restore nasal breathing while you're sitting, and then while you're doing light exercise like walking, and from there, while you're doing more moderate exercise like jogging. And then along this process, you want to restore nasal breathing at night, whether that is through improving oral posture and movement in order to naturally keep the mouth closed at night, or implementing some kind of external intervention that's going to help you restore nasal breathing during that time. The overall goal, though, is to restore nasal breathing both day and night. And the biggest principle here that I want you to note is that the nose follows a use it or lose it principle, just like many other parts of the body. Okay, so one of the reasons you or your child might not be good at breathing through your nose is because you're not breathing through your nose. Sounds kind of strange, because how do you breathe through your nose if you can't breathe through your nose? And again, we'll talk you through this. If you have severe blockage and you literally can't get any air in or out, there are going to be some exercises I want you to try. One of those being controlled pause. Okay, but if you're getting kind of a moderate amount of air in through your nose, I want you to begin here by increasing your awareness of when you are breathing through your mouth, and try to stop that, close your lips, and breathe through your nose for as much as you can throughout the day. Now, I don't want you suffering, and I don't want you doing anything unsafe here. So what I would do is push yourself into the moderate discomfort range, not severe, okay? And then let yourself mouth breathe again if you need to, in order to kind of get enough air and restore yourself back to baseline. So again, number one thing, start being aware. Number two is start trying to intervene when you notice that your mouth is open. This is going to be very difficult initially and kind of annoying, but just stick with it and follow the rest of the videos here in this process. And this should help you rule out if we can restore your nasal breathing by the most natural, non-invasive methods available. If you have any questions about this process, please write it in the comments section below, or find me at summerspt.com.